In Richmond, it's an anxious day for one of Scott's long-term clients, drama teacher Julia.
Such a good girl, aren't you? Yes, you are.
My last pug was called Oscar, and I always wanted him to have a wife, and I thought I'd have to call her Bafta, so I'd have Oscar and Bafta. But alas, he died before I got Bafta, but I still called her Bafta. So that's how she got the name. Another close-up, Mr. DeMille.
Recently, Julia became alarmed when she discovered a lump growing under Bafta's eye.
Getting sleepy again, aren't you?
A biopsy confirmed that it's cancerous.
Which was a horrible blow to me, because I always hear that word. You just think, oh no. I don't think it's nothing. I'm just hoping that it turns out to be nothing. That's what I'm hoping. What can one do but hope?
There's a good girl.
Today, the little pug is booked in with Scott for surgery to have the whole lump removed.
Bafta, are you all right, Daddy?
It will be sent away for further testing to determine the type of cancer and whether it has spread.
Good morning, Julia.
Hello, Scott.
Hello,
Here she
gorgeous.
is. How lovely to see you.
And
How are
you?
you?
Oh, I'm grand, thank you very much. And how's our girl?
Are you going to look after my little pug for me?
Well, of course.
Thank
I
you.
dare not do anything else.
No, thank you. I know she's in safe hands.
Come on, gorgeous. Do you want to come in Uncle Scotty's safe hands? Yes?
Good girl.
Julia is an incredible lady. She's so much fun. She's so vibrant. She's so full of life. And Bafta's a great little dog. She's so characterful. She's strong and she's brave. She's pretty much Julia in dog form. Well, first things first, Julia. Tremendous matching outfits.
Well, we have to look our best, don't we, Beth?
And it makes the girl feel special as she's
Yes.
coming in for surgery today. So let me have a little feel of this little lump. So, yeah, it feels literally like a pinhead. Julia's brought Bafta back into the practice today because just recently we've diagnosed a mast cell tumour underneath her left eye. So mast cells can be devastating and they can cause lots of issues throughout the body, not just in the skin area that you find
yes.
them.
Yeah, I've got you.
And sadly for Bafta, she's a bit of a cliche when it comes to mast cell tumours because pugs are very prone to them.
Oh, poor little Beth.
So it's very good that we've found this very tiny lump early because it does mean that we can remove it and then find out exactly what grade the type of tumour is, and that really gives us a good idea as to how dangerous or not it is to little Bafta.
I've got you.
The range of possibilities today are either fairly benign, we can remove it really quickly and easily and it shouldn't spread, or it could be a very nasty type, which means that it may have already spread to other parts of Bafta's body and it could mean that Bafta isn't around for very long. You and I have been friends for a while, so
Yes,
I know
Scott,
and I can see that
absolutely.
you're worried.
Well, of course I am, but I know if anybody can sort her out, you will. I'm terrified, to be honest, because maddening though she is, I adore her. I shall be relieved if we hear that nothing awful has happened, but I shall worry, of course I will. Yeah, it's just got to hope. Be good for Scott. Yes, good girl.
Hi, Tina.
Hi, Lily. What do you have there?
This is a little stray that's just been handed in at reception.
Oh, hello, beautiful.
She's gorgeous.
At the Isleworth practice, Nurse Lily has a new patient for vet Tina.
She was found by a member of the public
Okay.
who was a bit worried about her, but she feels a little bit skinny, so she's brought her into us.
All right. Should we just check you over, honey buns?
She brought her in and said if we didn't find an owner, she'd like to adopt her, but she thought she should do the right thing and double check first.
Let's see if you belong to anybody, miss. Okay.
Hopefully she does.
The first step is to see if the stray kitten has a microchip.
You just got to remember when you check, they can migrate under the skin. So you always check the whole body from head to tail, including the legs. So unfortunately, there's no chip there.
Oh, sorry,
So
miss.
There's no owner, I'm afraid.
Oh.
Okay. It gets a little bit difficult when there's no microchip because there's no way to trace where the animals come from. It puts the importance to remind owners that Cats do need to be microchipped. They wander around and they can easily get lost, as in this case.
She's been scratching quite a lot. I think she might have some fleas.
Oh, there's a flea.
I think we found the cause for scratching then.
But Tina has another more serious concern with the little stray. Depending on eye colour, up to 80% of white cats can be born with congenital deafness.
So what I want you to do is I want you to try face her and keep her on you. And then I'm going to make a noise over here, quite a loud one, to see if she can hear it, okay? All right. So just get her attention that way. She's reacting, not as much as I'd expect her to. I'd expect a cat to
turn round. Yeah.
Okay. So she's reacting a little bit to the noise. So probably there could be a little bit of a hearing impairment there. So that's something we just need to keep in mind.
Yeah.
If we can't find the owner, then we might need to look at rehoming to mention to the prospective new owner. I'm not too worried about her quality of life. I examined the ears with the otoscope and they're healthy inside. So it's possibly something she was born with. And if she has a little bit of hearing, she will adapt all her other senses and manage and have a good quality of life with the right owners.
You're going to stay with us for a week? Yeah.
I think that's a good idea, hey? We can fatten her up a little bit.
Yeah, she's probably very hungry.
Definitely.
Legally, we have to keep her here for 7 days and advertise her to see whether we do find an owner. Hey, sweetie, should we get rid of those nasty fleas before we give you some dinner? How does that sound? Yeah? So we'll just have to watch and see whether anyone comes forward. But either way, whether we find her old owner or the lady takes her home, she's got somewhere to live for the rest of her life.
You're looking for food, miss, aren't you? Should we go give you some dinner?
Oh, that's a funny noise, isn't it? Hey, Reagan.
Hiya.
This is Bafta.
Hi, Bafta. Hello, cutie.
Oh, wow, she likes you.
Hello.
In Richmond, Scott is about to perform surgery on little pug Bafta.
She's a girl's girl, I think.
Vet nurse Reagan will be assisting.
So what is it we're doing with her today, with her eye?
Well, yes, it's a tiny, tiny little lump. You'll barely be able to see it just in the skin fold here.
Okay.
And unfortunately, we took a little sample because we're a bit worried about it. We sent it off to the lab and they've said that it's a mast cell tumour.
Okay.
All right, should we give you an anaesthetic and get that nasty lump off? What do you think? Still wagging your tail, so that's a good sign.
Today with Bafta is all about just getting rid of this lump. We want to take quite a wide margin and remove it completely to allow the pathologist to have a look, not only to grade the tumour, to tell me should I be concerned about the possibility of its spread, but also has it spread locally within the skin itself.
All right, sleepy time now. Brave girl.
Good
Here
girl.
you go. Oh, good girl. All right.
Brave girl.
Suddenly, there's a problem. Bafta has stopped breathing.
Come on.
Come on, Bafta.
Come on.
Come on, Bafta.
At the Richmond clinic, Bafta the pug is about to undergo surgery to remove a cancerous lump. But suddenly, she stopped breathing.
Pugs always present quite a challenge when you anaesthetise them because their nostrils generally are quite small, but also in the back of the throat there's an elongated soft palate that floats over the windpipe. And it means that when you knock them out under anaesthetic, they can't really breathe very well. Come on. More breath there.
Was that what did you say? You just saw one?
Yeah, there's another one. A few little breaths there. Did you see that? Yeah.
Okay.
There you go,
Sticking
Bafta.
in.
That's what we like to call in the veterinary profession breathing. You know? It's not
what
too
we
much to ask for, is it really?
No, it's not, but it is what we want to see, so.
Bafta did something that a lot of dogs do, which is breath holding. So when you give the anaesthetic, they don't breathe for a little while until the carbon dioxide levels build up to the point where it encourages the animal to breathe. But in the case of a pug, you have got all of these abnormalities to their respiratory tract anyway. So the last thing you need is a pug that holds their breath. All right, so we can see the lump a little bit better now. So there it is there. Interestingly, as soon as we clipped the eye, that lump really did get quite angry indeed. It seemed to be mad that we'd exposed it. Now it had gone from kind of a pinprick-sized lump to quite a decent-sized red mass. So now more than ever, I'm very keen to get rid of it. Okay, let's go. Good girl. Come on then. Okay. Good girl. That's it. Here we go. Okay, so just about to start cutting. All okay? Yeah. There'll be quite a decent amount of tissue I have to pull away here. We're dealing with really quite small margins here. I can't move too much because it's in a really important area around the eye. So if I cause too much tension, then it might affect the way the eye can close and obviously how Bafta looks. So it's a balancing act. There we go. All right, so that's that little tumour out of Bafta's body. Now I'm sending off the mass to the lab and we have an agonising wait over the next few days until that result comes back. I'm really hoping that the tumour that I've removed is a low-grade type of tumour, and by removing it simply, that's the end of the problem. But it could be that it's something quite malignant and can have already spread through Bafta's organs and really be a major issue in her future. There you go, sweetheart. There we go. All right.
She is a really cute pug.
Right there. Is that right? Hopefully that's pug for thank you.
I think so.
Bafta will sleep off the anaesthetic and be ready for collection later in the day.
Hopefully that's that, eh?
Hello, Maz.
Hello, Julia.
I've come to fetch my little Bafta. How is she?
She's good.
3 hours later, Julia has arrived, anxious to see her precious little pug.
So where is she?
Right, if you grab a seat, I will let Scott know you're here.
Thank you. I will grab a seat. Bye-bye, boy. You're very gorgeous. Yes, you are. I didn't really sleep last night because I was worried about her. I just want her home with me to know that she's all right.
Hello, Mummy.
Hello,
There she
Baffy.
is.
Hello, my little Baff. Oh, what's she got her little tongue like that for? Oh, she's a bit dopey, isn't she?
She's nice and sleepy, which is quite useful, isn't it, to be able to examine this eye. But you can see, hopefully, there, I've removed
Oh,
the
yes.
lump there.
Yes. Oh,
A
yes.
little bit of plastic surgery to boot to
Well,
make it
thank you for doing
beautiful.
That's
But of
brilliant.
course, now we have our
We have to wait for the
anxious
results.
wait to get the lab to do what they need to do in order to determine how worried we should be with regards to this
I
tumour.
understand.
Although I'm really happy to have the cancer removed from Bafta's face, I'm obviously very concerned about whether it's spread or not. I'm really hopeful that it hasn't. I've done everything I can to try and rid Bafta's little body of cancer, but all we can do is cross our fingers and pause and hope for the best.
I think you'll deserve a Bafta after today.
I think you deserve a Bafta.
I think
after
you
today.
do too, Scott.
Well, thank you very
We all
much.
do.
Let's give ourselves awards, shall we?
Let's have a Bafta party, especially if everything's all right.
Yes.
Definitely.
Okay. All right.
Definitely.
Well, I'm going to bring the champagne for when I see you next.
And quail's eggs for her, because she loves quail's eggs.
Quail's eggs?
Absolutely. Absolutely.
Shira, come on. You're all right. Good lad.
At Scott's Richmond clinic, new patient Shira has arrived with his owner.
Come on. Good boy. Hi, Sam. Hello. How are you? I'm all right. How are you doing?
Bethany and her 13-year-old collie are good friends with Nurse Sam.
You're very nervous, aren't you? Don't like coming to see vets.
No, he doesn't like it. He's not a happy boy. Poor little lad.
So Shearer is a lovely boy, but he is a collie. So collies have some quite specific breed traits where they can be a little bit suspicious.
Oh, he's really scared.
Which has made it very difficult when we come to the vets because he gets very nervous. And as soon as things get a bit serious, that's when he starts to get a little bit snappy.
Come on,
You're going to be all right.
Come on. This
He's not so sure.
Bless him.
The 13-year-old collie is extremely anxious around vets, so it's been a long time between checkups. Bethany is hoping Scott will be able to win over the nervous old dog.
Hello, Bethany. How are you?
I'm all right, thank you.
Oh, that's good. I've heard lots about you, but possibly a little bit more about your chap.
Oh, yeah, he's all right.
Well, we'll do the pleasantries in the consult room, shall we?
Okay, cool.
Come on through.
Shearer, this way.
I know that Scott would be sensitive to Shearer's anxiety and he won't mind potentially getting bitten.
This is what he does most. He just kind of hangs out at the door. You can smell freedom, can't you?
Is that the escape route, my boy?
Yeah. He's not a massive fan of the vets. Don't take it personally.
Okay. Sam's given me some history on Shearer, and he has just had some unfortunate incidents at vet practices. So hopefully a new environment, a new vet, he might be a different dog. Fingers crossed. Now I'm just gonna do my usual thing of not really looking at him in the eye because that's always a bit threatening.
Yeah.
And just sort of be quite dismissive and submissive and just see what he does. Hello.
He's just one of them collies where the signs are very subtle.
Yes.
His ears go back and his eyes go wide, and then that's him saying.
And it can just be just a like, I'm fine, not fine. Just be very...
he doesn't give much warning. He won't growl. He will just snap.
Okay, my heart rate's rising just having this conversation. So beyond his little snapping issue, what else is concerning you?
So he's got a lot of lumps and bumps all over his body, but then there's one hard lump that's come up on his shoulder blade that I'm a little concerned about. Check his teeth. He's also not microchipped.
He's not
Or
microchipped.
vaccinated.
Right. Well, we definitely need to microchip him.
Yeah.
Now the law is in, we need to make sure that's done. And vaccinations are always important. So, wow.
Full service, please.
Yeah. So what's probably best is that we go downstairs together, you pop the muzzle on, then you say your goodbyes, and then we get going.
Okay.
Yeah?
Brilliant.
Come on then. Come on then, mate. Good boy. Yeah, always very keen for that door, isn't he?
Yeah, bless him.
Escape. Hooray!
There's another one.
So far, Shearer has been beautifully behaved, but you can tell that he's quite nervous and that makes him unpredictable. So sadly, we still need to muzzle him in order to put him under anaesthetic and fully assess Bethany's long list of concerns. All right.
It's like leaving your baby.
Auntie Sam will look after you.
Knowing that they want someone that they know around them and there's just lots of unknown people and they're sticking needles in him.
All right, Bethany.
Okay.
See you later.
See ya.
Bye. I know.
It's really tough and just hoping that everything will be all right.
We're not all bad. No. In order to get Shearer anaesthetised, we first need to sedate him, but he's a nervous boy and so not going to take this lying down. So we need to use a technique similar to the one we use in larger animals, the door technique. I know, Matt, I think you have an awareness of what we're about to do, don't you? We feed the lead through the gap in the door so we can squeeze him with the door and the wall, and it produces a race, which is what we use in horses, for example, to keep them still and protect the people that are working with them. Okay, Nathan, you ready? Let's just hope that this nice, genial chap will take it well. Good boy.
All right.
Okay.
Good boy.
Good boy. If you just move him towards the door.
At Richmond,
Okay, Nathan,
Scott
ready?
and his
Just
team
move
are
that
trying to
over there.
sedate nervous collie Shearer.
Good
boy.
All right. Good
Okay.
boy. Good boy.
Good boy.
Good boy.
Good boy.
Shearer's all right.
Nathan,
It's all right.
Well done.
Good boy.
Well done, mate.
Good
You got
boy.
it. Yeah. Good boy. Good boy. Good boy. Oh dear, horrible people. Okay, yeah, we'll let him back out again. Oh, what awful people we are, hey? Oh dear. Oh dear, that door. Hey, I blame the door, don't you? See, look, he likes me because he thinks you're horrible. Shearer's not a bad boy. He's simply afraid. But a fearful dog is an unpredictable dog, and so sadly, we just can't take any chances. Phase 2.
Ready?
No one's there. We're ready. Oh, he's a good boy. That's it. That's a great shot, Sam. Well done. Once the sedation starts to kick in, we place a second muzzle over Shearer's eyes, which helps to keep him calm and that allows us to place the catheter and finally get him anaesthetised.
Can you just come and turn the anaesthetic on for me, Sam?
Okay, so.
Good boy. Big, deep, calm breaths. It's all right. Okay, good boy.
Now that Shearer is finally under, we have to work quickly, and that's why I've got both Sam and Nathan helping me today. Bethany's given us a really long list of concerns to get through, and at 13 years old, Shearer's an old boy, so we don't want to keep him under any longer than we have to.
Now, let's have a little feel of where that lump was. If we all just have a good feel of him just from head to toe and feel anything that you're concerned about. Ah, there it is. Can you actually pass me those clippers in front of you, Nathan, please? Yeah, having a little feel of this, it's a clearly defined lump within the skin itself. It feels a little bit fluid-filled. So I think that this might just be a dermoid cyst, so something that's a benign growth in the skin. I'm just going to pop a needle in it real quick. I'll just have a look under a microscope. Okay, everything I can see here is just normal tissue. So I think in this case, Shearer's an old boy. He's developed normal lumps or bumps that older animals do, but it's certainly nothing to worry about, so we don't need to remove it.
But Sam's found something that does need to be removed.
There's not a lump, but there is a big tick. It's quite juicy.
Massive. Ooh. Nasty blighter. Okay. Well, not bad news because we can just take that off. So let's remove that tick, please, Sam. Yep. Good news keeps on coming.
Ticks are nasty little creatures that suck blood, but they can also carry some really nasty diseases. In the UK, they can spread something called Lyme's disease, which people can also get. In the larger European continent, they can spread tick fever, and in Australia, they're known to cause paralysis.
Wow.
It's horrible.
Massive.
It is massive.
Oh, he's a big boy and he's still moving. Means you've got the head out, so well done, Sam.
The best way to prevent ticks is by using either a topical liquid applied in between the shoulder blades of your dog, or there are some oral medications that you can use as well. These things either kill the tick before it can bite, or if it does bite, it kills it before it can transmit those nasty diseases.
Scott now wants to check on the condition of the 13-year-old's teeth.
You know, really very good teeth for a dog of his age, and I feel like I've gone boldly when no one has gone before, which is inside the mouth of the savage beast. He's not really, he's a pussycat. Vaccinations are very important, but it's a shame with Shearer that this first has to be done under anaesthetic. All right, so last but not least, we'll just do the microchip and then we can wake this boy up. Chip. Great.
It's all legal now.
He is, he's all legal. Hey, good boy. All right, that's it. All right, let's wake this boy up. I think we're good friends now. Oi. I say to him whilst he's fast asleep.
Yeah.
It's not very often that you get a dog as old as Shearer come in with as many concerns as he had, and yet get to send him home with a clean bill of health.
Good boy. Now sleepy times for the old man, eh?
Hopefully, we've shown him that there's really nothing too much to worry about. I'm even hoping that I might have made a new friend.
Good boy. Yeah, have a snooze, I'll call Mummy. Good lad.
What's this?
At the Isleworth practice, Nurse Lily has her hands full, looking after the little stray that was handed in 3 days ago.
You really were hungry, weren't you? So legally, we have to keep her here for 7 days and advertise her to see whether we do find an owner. We have to give them that opportunity to come forward and say, this is my cat. Can't get any work done when you're about, can you? Nope. Yeah, so we checked for a microchip, but we couldn't find one, unfortunately. So if she does have an owner out there, we can't track her down.
I can't believe no one's come forward for her.
I know, she's just so cute.
I know.
Look at that face.
The playful kitten is lapping up the attention from Nurse Lily and Aussie receptionist Liz.
You're adorable, aren't you?
Yes, you are.
Oh, bless her.
So funny.
Yeah, so we'll just have to watch and see whether anyone comes forward. If not, though, I think we might have an owner in the lady who brought her in, but she seems very keen to take her home.
Hello, champ. It's time to go home now. Hey?
Back at Richmond, Scott's patient Shira is ready to go home.
Take that off because I trust you. Yes, I do. There we go. Oh, he's a good boy. See? There we go. Should we go home and see Mummy? Yeah, come on then.
Upstairs, Shira's owner Bethany can't wait to be reunited with her boy.
I thought I was going to be all right, and then as soon as I left him, I started fearing the worst. It was horrible. I didn't want to leave him.
Where's Mummy? Where's Mummy? Go get her. There she is. Look, who's this?
Puppy, I'm so sorry. Oh, he's a good boy. Are you sleepy? Oh, you got me. Oh, how are you doing? Oh, puppy.
So, I'm very glad to see you guys together, and he has been such an angel. He's been a joy, really, haven't you, mate? You've been a good boy.
Joy.
But the good news is even better, because not only has he been a gentleman, but all the concerns that you had, they're not concerns.
Oh, that's brilliant.
So the lump here is just a normal old cyst that's present in his skin.
Okay.
And that's absolutely fine. No need to remove it. Yes, he's an old boy. He's got a few old dog problems, but that's all they are.
That's good. Well, at least
It's
we've
just-
come and got him,
Yeah,
got him all checked
checked over. But yeah, symptoms of old age, but not of disease.
Oh, yay, good boy. I'm so happy that he's got basically a clean bill of health.
Now I hope that you'll come and do some social visits. It'd be nice to see him and not have to do anything mean to him.
Absolutely.
Hey, buddy.
And Scott was absolutely brilliant with him. And now we can go home for dinner. Say thank you, Scott.
Bye, champ. Take
Thank
care.
you so
See you
much.
later. Nice to meet you.
Bye, you too.
Bye.
Good boy. Come on, puppy.
It's a new day, and in Richmond, it's an early start for Scott.
Oh, hello.
Hello.
What you doing?
I am packing up for a trip up north.
What are you going up north for?
Well, there's this amazing donkey sanctuary that's run by this incredible family of women who
Oh, yeah.
love donkeys. Jenny, the youngest girl, she has set this place up. Absolutely inspirational girl, but at the same time, they've been through a lot of tragedy.
Really?
Oh, they all attended the Ariana Grande concert. And Jenny's two aunts were caught up in the blast. They were quite badly injured. And they really struggled to keep the sanctuary going. And it's only with the help of volunteers they've been able to do that. So that's why I'm putting my hand up to go and help. Like everyone watching, I was horrified by the Manchester bombings. You feel so useless, as there's nothing that you can do to help. But today's different. I'm on my way to visit a family of survivors, and hopefully I'll be able to help by offering treatment to the animals they love.
Scott is heading 4 hours north to West Yorkshire and the Wonky Donkey Sanctuary. "19-year-old Jenny is the founder and is running the sanctuary with her mum and two aunts. They're currently caring for 19 rescue donkeys.
When donkeys do arrive here, they are in a very poor condition. You get a lot of time donkeys that don't really know where to place themselves, feel very uncomfortable. They do come in as a shell of a donkey, and then they end up being a very unique little character.
Hello, ladies.
Morning.
Hi, how are you? I'm Scott.
I'm Jackie.
Hi, Jackie.
Hi, I'm Jo. Thanks for coming.
Oh, you're very welcome.
I'm Josie.
Hello, Josie. Nice to meet you. There's a thing going on here.
I'm Jenny. Nice to meet you.
Hi, Jenny. Nice to meet you as well. What a perfect family to be running a donkey sanctuary where males are called Jacks and females are called Jennies.
Yeah.
It was meant to be, wasn't it?
Yeah.
I'm very excited to get stuck in and help you look after your lovely animals. So I'm going to chuck my overalls on and then maybe you can introduce me to my first patient.
Yeah, baby donkey first. So
Baby
she's a
donkey
lot of
first.
fun.
All right. Looking forward to it. You guys look like trouble.
So here she is.
Oh, she's gorgeous.
She looks gorgeous, but she's very, very naughty.
Oh, is that right? Are you naughty?
Come here, Rosie.
Rosie. Hello, beautiful. Hello. Oh, my goodness. You're so cute.
Rosie is the most adorable donkey that we've got, but mainly because she's the baby donkey. Having her as a baby has just been the most amazing experience, just to be able to hand rear her, really.
Oh, she's so nice. So what does she need doing today?
So today it's microchipping and vaccinations for Rosie.
Dear. I'll hug her now because she won't want to hug me later if I have to do all that stuff. All right. Oh, baby. Hey? Mwah. Ready?
Good girl.
Sorry to do that to you, sweetie. There you go. Performing a microchipping on a donkey isn't very nice. It is a little bit like harpooning a small horse. So we're just going to pop in a little bit of local anaesthetic under the skin just to make it as pain-free as possible. There we go. Good girl.
Come on then, Rosie.
Around this way. Brave girl. Brave girl. That's it.
Oh, Rosie, look.
Okay, you ready? Okay, brave girl. There we go. Okay.
Good
It's in.
girl, Rosie.
Very good. Oh, brave girl. Well done. Good girl. Well, the carrot worked.
Yeah, it did.
Good girl. All right, let's just scan her and make sure that that's working okay. There we go. Your donkey officially beeps. Good girl, Rosie. Well done. Now we just got to give her a vaccination. Okay, just going in there, and that's it. Done. Oh, good girl. She's been an incredibly amicable and easygoing patient, which is great for me. Not that much donkey experience. You're so lovely, but naughty. I can tell you're naughty. Hey, she's like a toddler, isn't she?
She is a very naughty toddler. We've entered terrible twos, I'm afraid, already.
Yes. Did you hear that? Yeah, yeah.
At the Wonky Donkey Sanctuary in West Yorkshire, Scott's next patient is Olaf the goat.
A goat at a donkey sanctuary?
Yes. He's still very new, but he is very sweet, so hopefully he won't mind you visiting him.
Jenny's Aunt Josie is still recovering after her leg was badly injured in the Manchester bombing.
Come on, good boy.
And she feels a special connection with Olaf.
I think it's when you see that something can be so frightened and confused and they don't understand, which is very similar to being in a traumatic event. You can just go and have a little touch and you see them improve and gain confidence. It's so rewarding. I think it gives you that good feeling and that's what helps you to heal, you know.
Well, there's a lovely old goat.
Which one?
How did a goat manage to find his way to a donkey sanctuary, Josie?
Well, we got contacted by the police at 3 in the morning to say that they'd found a donkey on the motorway and would we take it in? So, of course, we said yes. And then this arrived. So he said that it's not actually a donkey, it's a goat. We said, oh, right, well, we'll take it anyway. So we took him in, very timid. He's a really sweet little man.
He's very sweet.
We don't know anything about him, of course, and no one's claimed him. So it looks like he's going to be staying. We don't know if he's been hit by a car at all. He just spent 3 days in a corner, wouldn't come near you. Jenny went in, spent quite a bit of time with him and progressively started to eat and drink. Donkeys are fascinated by him.
Yeah, I bet they are. Again, that's the weirdest looking donkey I've ever seen. All right, so what do I need to do with this guy?
Well, he needs vaccinating, worming and hoof trimming.
Right, go. You're a taskmaster, you are. Yeah. Have a little look at your hooves. Come on, my man.
I think it's the left front one that seems to be twisted.
You can see it's actually flared out a little bit, isn't it? That toe is just a little bit overgrown.
Yeah.
Okay. He's probably been on soft ground for quite a while, and as a result, they're overgrowing and it's leading to him rolling in on his hooves. So you can see the insides of both of his cloven hooves there are just a little bit wide, so we just need to trim away a little bit of that. Just taking that extra bit off there. All right, sweetheart, there we go. I haven't done a goat manicure in a while, I must admit. Good boy, you're being a very brave boy. Not as brave as your mum and your great aunt, but you know, he's been pretty good. Because you've had a few problems with your leg as well, haven't you?
It was a bit of an ordeal.
I can imagine. And he's complaining about a hoof trip.
I know.
Honestly, I'd be keeping quiet if I was you, young man. Gee whiz. Josie's an incredible woman and so brave after what she's been through as a result of the Manchester bombings. But now she's back working here at the sanctuary doing what she loves, which is looking after these beautiful creatures. Milkshake for goats, eh?
Scott did really, really well. He was patient, kind, firm, and got the job done.
Well, he was a pretty good patient, what do you think?
He was very good, yeah.
All right.
He's come a long way in a short time.
He has, yeah.
In Isleworth, it's now been 7 days since a stray kitten was handed in, and it's an exciting day for her rescuer, Georgia.
Hello. You come to pick up your little white cat?
I have.
Has she got a name yet?
Yeah, I've called her Alba, actually.
Bless, what does it mean?
No owner has
Means
come
white and
forward to
Latin.
claim the little
I like
kitten,
that.
so a delighted Georgia has come to adopt her.
Do you want me to go get her for
I
you?
really love that, yes, please.
No worries.
Thank you. I fell in love with her the moment I met her, so I couldn't really resist buying her toys and cat litter and the trays in the hope, that she would be mine. And I've never had pets before, so I'm just really glad that I can have her.
You ready to meet your new mum? I think that's a yes. Here she is.
Oh, hey! Oh, hello, Alba. Hello.
I think she recognises you.
I think she does. Hello, baby.
It's so nice to see the reaction of both of them, and I'm sure Alba will have a fantastic time at a new home.
She was just so hungry and skinny when I met her.
I found her in the street and she looked really hungry, so I brought her into the nearest vets that I could find. I could have taken her home there and then, to be honest with you.
You happy to have her in your arms?
Oh, I'm so happy. I've had to wait a week, haven't I?
I know. We're all going to be sorry to see her go here. She's so sweet.
Hey.
It's a lovely thought, really, that Alba possibly chose me as her owner, because when I first met her and she was really purring and really affectionate, and she cried when I left her at the vet's the first day I brought her here. So, to be honest, it's a relief that I can take her home today.
Here's your transport to your new home.
Let's get you home, darling.
Here we go.
Yes.
It's been amazing to have Alba here all week. We're really going to miss her, but she's definitely going to a great home with Georgia. And although it is sad to see her go, I'm so pleased she's found a home.
Thank you so much.
No worries.
I can't thank you guys enough. I'm so glad I brought her in.
No worries.
Thank you.
Bye.
Bye.
Oh, we'll get you home.
My goodness!
At the Wonky Donkey Sanctuary in West Yorkshire, Scott has one last job.
Where have you been hiding these little kitties, Joanne?
Scott's been asked to look at new mum Coco, trying to care for 5 hungry pups.
She looks like she's seen some better days, though.
Yeah, she's not doing too well regarding her weight and her skin.
Mm.
Coco is a lovely Rottweiler girl. She's about 2.5 to 3 years old. She arrived here from her old owners and they couldn't look after her anymore owing to family health.
I'd say we'd have to think it's probably some kind of mange, and I would suggest it's probably sarcoptic mange.
Yeah.
So I would like to officially announce that the milk bar is now closed.
Woohoo, Coco.
I don't think that this little lady needs to give up any more of her hard-earned nutrition on these puppies. She's done a great job. It's very clear that Coco is very thin, and as a result, her immune system is going to be quite weak, which is probably why she's developed the mange in the first place. The puppies need to be weaned, and so Mum can start putting on some weight and getting healthy again. So we're just going to apply a liquid that we'll be using every couple of weeks just to try and knock off the nasty mange mite. If you give her a little treat whilst we put this on. Hey? Here. What's she got? Oh, what's she got? That's a good girl. There you go. So, my love, I think let's start that me time right now. And I think because we're going to have to examine the puppies and probably have to do a few mean things to them, it's maybe best that slightly nervous mum goes and have a little rest.
Yes.
Yeah. Hey?
There you go, Sammy.
Good girl.
Thank you.
Well done. She's off. I've shown a lot of restraint. So, look, hand over the puppy. Come on. Oh, look at you. Mwah. So who's this one?
This one's Bear.
Bear.
Yeah.
It's a good name. He's going to be a big bear, aren't you? Yeah. Now, these guys, a bit young to be vaccinated as yet, but we can microchip them.
Yeah.
So have we got something to entertain his mouth in? Have we got some... Oh, here we go. There you go. Very good.
You ready?
Brave boy.
Oh, well done.
Well done. Good boy, Bear. So let's just make sure he beeps. And he beeps. What a brave boy. Right, so who have we got next?
We've got Prim here.
Me too, one. Oh, wow.
Good girl.
She's done. Okay. Good boy. Well done. I can't believe how brave these puppies are being.
Well done.
And then last one. Very brave puppies,
Good
eh?
girl. Yeah.
So that's 5 very healthy puppies, all microchips, and they took that on the chin very nicely, I thought.
They did really well. Yeah.
Yeah. But I just can't believe the amount of work you have to do looking after the donkeys and a goat, and then you take on dogs as well. But there sort of is a little bit of reward, isn't there?
There is.
In its own sort of special way. Isn't it? Yes, yes, yeah. You're a nice puppy.
But now it's time for Scott to say goodbye to owner Jenny and her family.
I think we'd better finish that bit first, yeah?
Eating well?
Very good, very good.
Jumping on a carrot. Well, I'm going to head back to London, ladies. So thanks so much for having me.
You're very welcome.
Yes, thank you for coming.
Enjoyed it.
Really appreciate it.
Can I just have one more donkey cuddle before I go? Goodbye. Goodbye. Mwah. Oh, love it. See you again.
Bye, Scott. Thank you.
Now, Baffy, we're waiting for Scott. I don't know whether to look forward to seeing him or to dread it.
In Richmond, Julia is at home with Bafta, nervously awaiting Scott's arrival. Scott recently removed a cancerous tumour from underneath Bafta's eye. Today, he's making a home visit to deliver the pathology results.
Hello,
Scott.
Julia. How are you, lovely?
Well, I'm a bit apprehensive,
Are you?
as you can see.
Baffy, you're looking a little bit grumpy. All right, come on. Let's chat things through. So, we knew it was a tumour, okay.
I know.
But the news is good.
Scott! Oh, tell me.
So, it's come back as a low-grade mast cell tumour, which means it's highly unlikely to spread.
Oh, wonderful.
Yeah.
Oh, thank God. So I'm not going to lose her.
You're not going to lose her anytime soon.
Thank you so much. I can't tell you how worried I've been.
You're very
Oh, I've been so worried.
I know.
Oh, that's wonderful, Scott.
Well, I think with all of that good news, we need to celebrate with our Bafta party. Bubbles, baby.
Oh, hooray! Baffy, look, Baffy, you're going to have some of that.
And apparently, quail's eggs.
My God, Baffy, they're your favourite, aren't they?
It's possibly the poshest dog treat I've ever heard of.
I feel really happy and really relieved. And maddening though she can be with her barking and her greed, I don't want to lose her. So I'm very glad I'm not going to. Oh my God.
Oh my goodness.
It popped, didn't it, Baff?
Well, I'm glad I'm better at surgery than I am at opening champagne bottles. Okay, Baffy, let's not forget you. Ready? Nice and gently, please. Oh, yeah.
Another, please. He has saved her life. He shouldn't be called vet on a hill. He should be called vet on a pedestal, because he's certainly on a pedestal for me.
Well, cheers to Bafta. Long may she reign.
To Baffy And to Scott, thank you so much for what you've done. Saved my little girl's life. Thank you so much.
Cheers.
Means so much.
Hi. This is Fifi. We're here to see the vet.
Yeah, no problem. Just take a seat over there for me.
In Richmond, Eva, Adam and their son Jakob have brought in their injured spoodle Fifi to see Scott.
Fifi had a little accident and we went to emergency vet yesterday, and it's highly possible that the leg is broken. So we're here to see Scott.
We are really worrying because we can see this it's not right because she's like crying.
Hello, guys. Your eyes. Oh dear, Fifi, you're looking very sad today, and sporting a very interesting sock. So I think that tells me something. Let's have a chat, shall we, guys? In you come.
We pray that Dr. Scott will put her back on her 4 legs as soon as possible.
Tell me what's happened.
She fallen down the sofa.
She fell off a sofa?
Yes.
Okay.
And this is the temporary bandage, emergency one.
Poor little Fifi. She's such a sad little shadow of her former self. Normally she's the bouncy, happy, white, fluffy dog, like my dog Scully. She looks very sad indeed. Now, is it very sore? Yeah, she's quite tender. Just me touching that a little bit
Yeah.
is enough for her
No,
to
she
flinch.
didn't want us to touch it at all.
Well, I think probably what's best is if we just do a little conscious x-ray. And from that, we can work out exactly what's going on and what we're going to do about it. Sound good, Jakob? Hey? Yeah? Have you fallen off the sofa ever? Let's just check this arm.
Just to be sure.
Yeah, that's good. That one's good. Excellent. So hopefully, Fifi's leg will be good too. Yeah? Okay then, Fifi, let's pop you downstairs. Okay, guys, if you grab a seat up front, I'll take an x-ray with your little girl and then we can have a look at the x-ray. Yeah? Okay. All right. Say bye-bye. Bye. See you in a second.
We really worried what Scott will say and what's the condition of the leg as well and what will happen.
All right, Reagan.
Nurse Reagan will be assisting Scott with the x-ray.
Good girl. Taking Fifi downstairs, it's very easy just to pop her leg under the x-ray machine with me all gowned up in lead.
X-rays.
And we'll see what lies beneath.
Wow.
Oh. Gosh. Yikes.
At Scott's St Margaret's practice,
Hi, Beata. How are you?
Fine, thanks.
concerned owner Beata and her pet hedgehog Luther have arrived for an appointment with vet Tina.
And Tina will be with you in a minute.
Thank you.
Okay.
She has a small bump on her head, and I want it to be checked that there's nothing wrong, just to be on the safe side. I really love her. I can't imagine that there is something wrong with her again.
It's been a tough few months for the little hedgehog.
This is very hard.
She had to undergo major surgery when Scott discovered a huge cancerous lump that had to be removed.
So this is absolutely huge. I mean, for a hedgehog, this would be like having a bowling ball growing in your abdomen. Oof.
Morning, Beata.
Hi, Tina.
How are you?
Hi, I'm fine, thanks.
Come on, bring Luther
Really
too.
great.
The love Beata has for Luther is comparable to any other relationship any owner has with their dog or cat or parrot. It's just so special and it's very touching, actually. All right, what's going on with Luther today?
I just want you to please do a checkup because there's a small bump on her head. It's very slowly growing, but I think it just, to be on the safe side, just have a look at it and then try to figure out what is it.
Okay, let's get her out and have a little look. Hello, honey.
Oh,
She says I'm tired. Oh, come on.
Luther.
Come on. Are you going to let go of the blanket, honey? Luther's come in today quite a bit hissy, which I think is more related to the practice and the smell of the practice and a remembering of her previous time here. Maybe bring her out with the towel and when we put her down, she might let it go.
I don't think. No.
Here we go, honey. Come, we can be best friends again. Beata is concerned about her baby and we need to put her concerns to rest today. Maybe she did bump her head or something like that.
I don't know.
So what I would like to do is to give her a little bit of gas again like last time so that she can let me sample it, and then I can make a smear and see what's in there and if it's something we have to worry about. Any lump or bump that you find on any animal is a concern. There you go. We need to make sure that it's not something nasty that can spread. So we need to take the relevant steps, and today we'll be sampling it first to see if it does need removal or not. Say bye, Mom.
My love.
Oh, we'll look after her.
I know.
Bye.
Come around here, guys, and take a look at that.
Back at the Richmond Practice, Eva, Adam and their son Jakob are finding out the results of the X-rays on little Fifi's injured leg.
So this is one bone or there are two bones?
2 bones. The radius and the ulnar are both in the forelimb, in the forearm, and they've both been broken. So it's an extreme fracture for just falling off a couch. But the thing is with these little dogs, they have really brittle bones, and just an unfortunate fall can lead to a fracture like this.
From little jump, she ended up with like proper broken leg, so you know, no one expected this. So will the bandage be okay for it? Will it be enough?
Unfortunately not, no. What you can see there is the muscles have contracted and we've got overlap of the fracture site. So this will heal very badly if it isn't fixed internally. So we're going to have to use a mixture of pins and plates, lots of hardware. It's basically a bit of DIY with a pulse, I'm afraid, for little Fifi, but it does need to be done. Yeah. So your little dog needs surgery. It's no good, is it? Okay, guys, well, I'll take care of your little fluff ball. And you guys head home and we'll see you a little bit later.
Thank you so much.
Thank you very much.
My pleasure. Bye, guys. See ya.
In touch. Thank you.
Bye.
We are really, really worried, and I hope everything goes well. Fingers crossed.
Good girl, we'll fix you up. Here we will. Here we will.
Hi, honey. Hello. All right. Here's Luta.
Oh.
Okay, so she's got a little bump on her eye. So
Okay.
we just need to have a check.
At St Margaret's, Nurse Sam is assisting Tina with the procedure on Luta, the African pygmy hedgehog.
Hey, look at you. Hey, you can actually see the bump on her left eye while she's curled up. Bit pink in color. We need to figure out if it's a growth or a cyst, and if it is a growth, how nasty that growth could be.
2 months ago, a malignant tumour was removed from Luta's uterus, and Tina is now concerned the cancer may have spread.
Okay, all right, let's quickly turn her on her back and we can do a quick scan. While we've got her under the general anaesthetic, we're going to quickly do a little ultrasound scan of her abdomen just to check that everything is all right following her previous surgery with us when we removed the tumour from her uterus. So basically I'm looking for big nodules or circles or any large abnormalities. But at the moment, everything looks normal. Okay, let's get her cleaned up. At the moment, it's looking pretty good. I can't see anything abnormal.
Now Tina is going to take a sample from the suspicious lump that's appeared on Luta's head.
We're going to be sticking a needle into the bump to get some material to see if it's infectious, inflammatory, or if it possibly still could be cancer. Here we go. I'm hoping it's not connected at all and it's just a little bump and she's healthy otherwise, but the test will give us the answers. Look, there's fluid coming out of there. Okay, let's make a smear. Okay. I looked at the slides, and the one slide, there wasn't much on there, which was good, but the second slide, unfortunately, did have a group of cells, which I'm not 100% sure what they are, and we're going to send it to the lab for them to evaluate it, to let us know if it's something to worry about. I'm going to pop her in here. in her little safe place.
It will be a tense few days waiting for the pathology results.
She's already hissing at me. Hi, honey.
Luta will stay at the clinic a little longer before she can hopefully go home later today.
Okay. She's quite grumpy. There we go. How did it happen?
It's almost too hard to believe. She fell off a sofa.
What, and snapped both of the bones in her front leg?
Yeah, and she fell onto the floor about a foot. And that's what's happened.
Wow.
Yeah.
In Richmond, Fifi the Spoodle is being prepared for surgery to fix her badly fractured foreleg.
Okay, with that dressing off, you can see just how floppy that leg is.
Makes you wince, doesn't it?
The forelimb of a dog, like the forearm of a person, has got two major bones in it, the radius and the ulna, and both of them help to splint and give stability to that limb. And in this case, we have both of them broken, so it's literally flapping in the breeze. It's horrific.
Such a fine-limbed little thing, isn't she? So delicate. So we had to fix you right up.
Assisting Scott with the surgery is his new vet, Phoebe, and nurse Nathan.
Okay. All right, so nice and gentle there.
Her bones are really only the size of a chicken leg, so they can very easily break, and as a result, you need to take your time and get the best job possible.
Okay, everyone ready?
Yeah.
Okay, and just be quite gentle just with the fracture. There. Very clean break. There's no fragments, it's just two ends of the bone. Just trying to encourage these two bits to go back together.
These bones were overriding, and by overlapping like that, the muscles then contract. What that means for you as a surgeon is you need to stretch those muscles back out to get those two sides of the fracture site opposing again.
At the moment, she's got a leg a little bit like the S-bend of a toilet. We need to give it stability. So what I'm doing right now is placing a pin into the cavity of the bone. So we're going to put a pin up and then push it back down into the bone at the bottom, and that will put it in alignment, and then I can go back and put a plate onto the radius. You have to do it very delicately, Phoebe. I'm just going to push against you a little bit, okay? We have to do it very gently because it can easily shatter the whole bone if we're not careful. This is quite a nerve-wracking moment placing the pin because clearly Fifi's bones fracture easily, and we're putting quite a decent amount of hardware on the inside of the bone, so we have to be very, very gentle.
Oh, there you are. You're there.
That's perfect, Phoebe. Just like that, all right?
Once I'm able to stretch the muscles and get the two ends of the radius in our position, I then place a plate, and that's requiring drilling some holes, little pilot holes, and then screwing some little screws into that bone. I do 2 above and 2 below the fracture site, and that gives really great stability and should mean that Fifi makes a full recovery.
There we go. All right. It is now solid. Okay, so let's close up. So can I get some 3O monochrome, please, Nathan?
This plate will remain inside Fifi's body for life, attached to that bone, and then the bone will form a callus. It'll start sticking back together to itself, and that will give stability in the long term.
Okay. Oh, poor baby. Okay. Good girl. That's it.
Fifi will be kept at the clinic and closely monitored overnight to make sure she's well enough to go home.
Okay. Oh, that's it. Perfect. Just what you need. Oh, sweetheart, you're okay.
At St Margaret's, a concerned Beata has returned to be reunited with her beloved pygmy hedgehog.
Hello. Hi. Hello, ladies.
How
How
are
is
you?
my tiny baby?
Our baby's fine. She's in the consulting room. Are you ready to go see her?
Of course.
Vet Tina has taken some samples from a suspicious lump on the little hedgehog's head, and they've been sent away for testing.
I'm holding thumbs that these results come back perfectly normal. I'm not 100% sure, but we will find out, and we will do the best for Luta in the end. So she was a very brave girl today. We managed to get a sample from the mass. I've withdrawn as much fluid as possible, and I made a little slide and I looked at it on the microscope. One of the slides does have a cluster of cells that I'm not sure what they are. I'm just going to send it to the lab to see what they think it is. And then we take it from there, whether we need to watch it. We need to see if it's going to fill up with fluid again and we need to redrain it, or possibly look at removing it. And the lab should give us our results in about a week or so. So I will give you those as soon as they're in.
I don't want to think about the sample. You know, it's always you have to be very positive, and until no, I don't think there is no problem with her. I know.
Bye.
Daisy, you're gonna be all right.
The next day in St Margaret's,
Gonna be
Royston and Laura have made an emergency appointment for their very sick pug, Daisy.
We noticed her a bit lethargic and she wasn't really herself. She was panting a lot, she started shaking. So it was sort of by early evening, we got more and more nervous because she's just not herself at all. So we need to get it sorted.
Hello there, guys. Hi.
Hi, Doctor.
Hi, Royston. How are you, mate?
Morning.
Hi, gorgeous.
Hello, sweetheart.
Hi, Doctor.
You all right?
Well, not really well. These days, Doctor, not really well.
Hello, Daisy. Looking very sad. Panting a little bit. So you're not comfortable, are you, baby?
No, not at all.
All right, well, we better get you in and have a look at you, hey? All right, come on then, team. In we go. Daisy is a very much loved part of the family of 3 other dogs, and of course Royston and Laura. They're incredible clients, they're wonderful owners, and they adore their animals. Well, let's have a little examination. I mean, the first thing I could feel is she's just like a hot water bottle, isn't she? Yeah. She's so warm.
Yes.
Yeah. And that's why she's panting then, and obviously a bit uncomfortable as well. So, okay, let me just have a feel of your tummy, my love. Stand up. Wow, yeah. So straight away I can feel just how tense her abdomen is. She's really bearing down, like as if she was about to give birth or pass a big poo.
Exactly.
But that's not been happening, has it?
No.
We thought it was a stomach problem in the beginning, like because she couldn't pull, but no.
And let's just have a look at her back end then. So yeah, I can see it's a bit stained back there. And when was it that she last had a season?
She had a season about 6 weeks ago.
Yeah.
So just...
And is she drinking more than normal?
Yeah. Drinking a lot more than normal.
Yeah. Daisy's been brought in with a potentially life-threatening condition that's called pyometra, which is basically an infection within the uterus. Unfortunately, we do need to perform surgery on her and remove this infected uterus.
Well, we have to, I mean, it's the only way to get her well. Go ahead, you take the decision, we follow you.
Pyometra can be life-threatening. It can make dogs really unwell, and sometimes they don't survive the anaesthetic or the surgery or even get to the vet practice. Now, I have complained and begged them to neuter their dogs sooner. They know that. It's something they're very concerned about because Laura in the past, being from Colombia, had some bad experiences with vets, found it hard to trust them, and Royston as well, incredibly nervous about the dogs that he loves so much, worried about the anaesthetic and will they wake up from it. So they have held off from doing a spay, but unfortunately that has turned around to bite them because if an animal's spayed, they don't have a uterus, hence they can't have pyometra. There's been anaesthetic issues in the past, there's been concerns regarding how your dogs have been treated in the past that you've been so frightened of doing it. Yeah. But unfortunately, because of that fear, we're here right now, which is a real shame.
Yeah.
Yes. I've cancelled maybe 2 or 3 times the day before when she has to go for the operation to be spayed, just through nerves. I get nervous like weeks ahead of the time.
I know that you guys are super worried. I know that's the reason why we've been unable to get you in the building to do it, but it is something we desperately need to do, and now she actually feels unwell.
Yes, Doctor.
Come on then, I know you love them very much. I just need to remove that excess baggage is what I need to do. Yes. Say bye, Mummy.
Bye, my girl. We'll see you later on.
See you later.
Bye, Doctor.
Bye.
We are worried, but we, in the same way, we think it's
it
it's
makes
fine.
me slightly less worried.
Yes,
in
yes,
Scott's hands.
Yes.
But still very worried.
Yeah.
Very worried.
Sort you out, don't we, Kate?
Sweet. Sweet.
Hey, yes. Hey.
Scott's new vet Phoebe's next patients aren't at any of the clinics. They're out on the streets of London.
Today I'm off to the Strand in central London to help out with a charity called Dogs on the Street, run by a lovely lady called Michelle.
Stands out.
Really looking forward to it.
Oh, was that a visitor?
Hi!
Hey, how are you?
I'm good, how are you?
Yeah, fine, nice to meet you. Thanks so much for coming along today.
No problem.
This is where you're going to be today. Okay.
Can't wait to get started.
All right, let's get the tables out.
Yes.
Let's go.
Let's go.
Dogs on the Street is a not-for-profit, voluntary-run service providing free vet care, training, grooming, all the essentials for the homeless community with their dogs that live out on the streets in central London. We're here with a team of vets, vet nurses, a trainer, grooming van, and also volunteers, so that when they come along, everything's there for them to access.
Hiya!
How are you?
You're right.
I've come to see you for Fizz.
Hello, Fizz.
Phoebe's first client is Michael, with 15-year-old Fizz.
I'm not really sure what to expect. I've never done anything like this before, and it's really different to private practice. You were here a couple of weeks ago, is that right?
Yes.
These are very vulnerable people that have absolutely nothing, and maybe it will be hard to see them not maybe able to care for their dogs in the way that they would like. I'm hoping that we'll be able to give them the best possible care today. Right, should we get her on the scales then? On you get, Fizz.
Come on then.
About 24.5. So she's put on about 200 grams in a week.
In a week?
Oh.
Their diet is so inconsistent. It's just basically what they're in, they can actually get their hands on to feed. And again, the homeless people go without. They provide their dog more than they do themselves.
That's all I'm giving her on the dog chews.
Is that every day?
Yeah.
Okay.
Yeah.
So those have a lot of fat.
Yeah.
So if you were giving her that, then you need to give her less of her normal food. And I would say no human food if you can.
The dogs are their life, their dogs are their children, their family. They are the most loyal fur baby, as we call them, that they have. And, the love goes so deep, it's so hard to describe. But, yeah, they just mean the world.
Hi, Gary, I'm Phoebe.
Next up
nice to meet
is
you.
Gary, with
And
his
this is
best
Lola.
friend Lola.
Yeah.
And how long have you had her?
5 years now.
Wow.
Best 5 years of my life.
Oh.
Lola is my Staffordshire Bull Terrier. She was 1 year old. She was found abandoned in a flat. And I just moved into premises from the streets. I wanted a dog because the resettlement team thought it'd help me settle. And they went to Batsy with me and we chose Lola. And I've had her ever since. Yeah, I just love her.
In you come, Poppet.
Come on, Lolly. Good girl.
I haven't seen Lola before, so can you tell me a bit about her?
She had the elbow dysplasia.
Elbow dysplasia?
That's what they said, yeah.
Oh, OK.
Yeah, at the Blue Cross. And
so that's why Dogs on the Street have been giving her hydrotherapy sessions?
yeah, she's been having hydrotherapy. She's got 3 more left.
How many has she had already?
7.
She's had 7?
Yeah.
And how has she been doing?
She likes it, but she'll only do it if she's got a tennis ball in her mouth.
Elbow dysplasia is basically an abnormality of the cartilage in the elbow joint, which means that it doesn't develop properly. Should we just see how she walks then? And then you can get fragments of bone falling off and secondary arthritic changes. So it's quite nasty and it's quite painful for the dogs. Can you just walk her just to the end and back a few times?
Yeah. OK.
So to examine Lola, I trotted her up and down to see if I could see any lameness in those front legs, but she was walking really well. She's not limping at all, is she?
No.
Right then, Puppet. We'll have a little feel of those elbows as well.
Yeah. It's all right, Lol.
Look at that.
Yeah, she'd have cried if you'd done that a couple of months ago, yeah.
Yeah, she's got a really good range of motion on that elbow joint.
Yeah,
and
she
she's
never
not
used
painful
to.
at all.
No, good girl.
Seeing cases like Lola and Gary is what's so inspiring. He's helping her with her elbow dysplasia. She was the one who inspired him to get off the street in the first place because he wanted to do it for her.
Oh, you want to see more? The scales weren't lying, Lola. They weren't.
it's just another example of such a loving bond between an animal and their owner. And it's what inspires me as well to go into work every day, because you just want to strengthen that bond and keep it alive for as long as possible.
Good girl. No, it's not more treats. She's through, man.
Bye.
Bye. Lolly, come on. Good girl.
Hey, Sam. You all right?
Hello, how are you?
Good. Daisy's not so great, though. Poor little thing. She's got pyometra.
Oh,
Having your baby.
that's not nice.
So she feels like a little pug-shaped hot water bottle at the moment. So she's just not well, are you, baby?
At the St Margaret's Practice, Scott and nurse Sam are about to start surgery on sick pug Daisy.
Mummy, you're a much more bouncy little girl, aren't you?
The little dog has an infected uterus, and it's making her extremely unwell.
I feel for Royston and Laura because they feel very, very guilty that they didn't heed my advice about neutering.
Obviously, there's risks, but...
Yeah, and also being a pug, as you know, there's risks on top of that, and then she's a sick pug, which is even worse. Daisy is not in the best place for surgery. She's panting, she has a fever, and also she's a pug, so she's not built for breathing very well. She's got a tiny little flat nose and a flat face. So all the issues associated with breathing in that breed, compounded by illness, means that this will be a risky anaesthetic. Okay, sweetheart, we'll see you on the other side, yeah? Good girl. We very carefully and gently move forward, giving her the minimal amount of anaesthetic needed in order to knock her out. Spin around. There we go, sweetheart. Good.
But seconds later,
oh God,
Daisy's in trouble.
Even despite our best efforts, she stops breathing. Can you grab that drip bag and just bring it through?
Vet nurse Lily has been called in as an extra pair of hands.
Can I just put this under a towel?
Yeah. Despite all my tricks of the trade and then even some drugs, she still continues to not breathe. But what's then worse, her heart starts to slow down. Can you grab that drip bag and just bring it through?
Should we get the monitor?
Yeah, and the monitor as well.
At St Margaret's, 5-year-old pug Daisy has crashed under anaesthetic.
Daisy was in trouble. She'd stopped breathing, and with her heart slowing, we needed to make some very smart decisions very quickly. Just get some adrenaline at the ready, quick as you can, Sam. I asked for some adrenaline to get her heart beating stronger, and we give it to Daisy.
Do you want to give us an IV?
Yep.
SpO2 81, going upwards.
Okay, heart rate's much stronger now.
Daisy's heart rate is responding well to the adrenaline.
So about 1 in 5.
But she's still not breathing.
Be in a good position. Come on. There we go. That was her.
That was her. That's her again.
Yep. Okay, that's good. Okay, so just put her up to 2. This is why anaesthetics are risky. This is why we want to do spays on healthy dogs, not sick ones. There we go. Her heart rate's nice and consistent now, so she just needs to breathe in that gas and then we should be in a good position. Well done, everyone. She's back now. Gosh, she took a sweet time, didn't she?
Mm-hmm.
My heart was in my gut because it is like doing a procedure on someone's child. Little Daisy here, and we nearly lost her. Yeah. It's almost where their concerns are realised, you know.
Yeah.
They were worried about an anaesthetic. Well, for the last 5 minutes, so were we. So,
I think I breathed in that time.
no. My heart was down here. Although thankfully Mum was beating at times, Shez was trying not to. That's too much. Too close. And for people that, you know, talked about how much they trust you and how much faith they have in you, and then that happens, it's even worse.
Daisy's breathing is now stabilised, and Scott can begin removing the infected uterus that's making her so sick.
Okay, the size of it. So that's her left horn is just engorged with pus. Normally, a uterus of this size would probably be about your little finger, and that is much bigger than my little finger. It's massive. And the sooner it's out, the better for this dog. She'll feel much better, and so will I. Okay, I'm just going to snap the ovarian ligament now. Okay, done. Sam, how's the dog doing?
She's, her heart's going well. That's what we like, isn't it, Daisy?
I'm doing mega speedy surgery because none of us want to be here any longer than we have to be. And we both want to get her woken up as soon as possible. So there's a nasty uterus. Yep, sorry.
That's okay.
As soon as the uterus full of pus is removed, that's a massive relief on Daisy's system. She's no longer absorbing all the toxins that pus is giving off. Here she comes. Okay, there we go. Now she breathes. Back to those huggy, abnormal breathing ways. To see this pug make those lovely puggy noises on recovery was music to my ears. Come on then, Trouble. Let's get you all snuggly. Hey.
Daisy will sleep off the anaesthetic and will hopefully be able to go home with owners Royston and Laura later today.
2 rules: heart keeps beating and lungs keep breathing. Yeah, deal?
Do you think she would take a little treat?
Oh, yeah.
What's that?
Here you go.
Oh,
yes.
Back in the centre of town, Phoebe is helping the Dogs on the Street charity give free vet checks to the homeless.
So you do notes on all your patients?
Yes. Yeah, everyone has one of these. They have all the notes written on it.
Let's go and get Gizmo then.
Okay.
Good boy. Hi.
Hiya.
Gizmo's come for his check-up for his stitches.
His stitches. So he was castrated then?
Yes, he was,
A couple of weeks ago now, was it? Oh, he's really friendly.
Phoebe's last client of the day is Francesca, with her 1.5-year-old Staffy, Gizmo.
Where did you get him from?
He was rescued because he was badly ill-treated.
Oh, poor thing.
He was quite young when I got him, but he was very badly abused. He was very thin, very badly ill-treated. And I went in and took him, and that was it. I love him to bits. Yeah, he's my little baby. He's the only man in my life. My little dog.
You can see his little wound there. It's looking really good.
I'd had him done because he is quite boisterous and hyperactive, so he's come to have his stitches checked just to make sure that they're dissolving and that properly.
That's healing really nicely.
Oh, good.
Yeah, really happy with that.
Yeah.
It's holding closed.
Yeah.
It's not painful. It's not inflamed. And hopefully his hormones should settle down a bit now that he's been castrated. You'd never have guessed by the way that Gizmo bounced around the tent that he'd had an operation 2 weeks previously. I think Francesca probably has a hard job keeping him still at times. You got a lovely little dog here. I've fallen in love with him. He's stolen my heart.
Everybody loves him when he comes here.
You can tell just by talking to the owners for a couple of minutes how much their animals mean to them. They're everything to each other. Some of these people could maybe go into accommodation, but they'd rather be on the street than give up their dogs.
Right, thank you for your help.
It was lovely to meet you both.
Say bye-bye, Gizmo.
Bye.
Say bye-bye.
Bye. I've had such a good day helping out with dogs on the street. It was definitely more than a vet clinic, it was definitely a community. And you could tell that just by the fact that clients will come back week on week, even if their dogs aren't feeling unwell. Everyone has a bit of a chat. Yeah, it was really nice to see.
Oh, that's great.
I'll come back soon.
Oh, that'd be lovely. We'd have you back anytime.
Yeah.
Phoebe was amazing, you know, being it's her first time out here, sort of engaging with the homeless community as well. I think she's done great.
Bye.
Margaret's clinic.
She's showing off her breathing now.
Yeah, back to hug breathing yet again. Some sort of broken vacuum cleaner.
Daisy has fully recovered from the surgery to remove her infected uterus.
You don't even know, do you? What you put us through, all that stress.
Unaware of the drama during surgery, Royston and Laura have arrived to pick up their little girl.
Since we left, I've been a bag of nerves, just waiting for the phone call. As far as I know, everything went well. I guess we'll find out when we speak to Scott.
Hello.
Hi.
Oh, princess. Oh, princess.
The main cause for her illness, which is that uterus full of pus, is now gone. But I'm very glad to have passed her back to you because she wasn't breathing initially when we gave her the anaesthetic. So the concerns you had regarding the anaesthetic were valid. But then her heart started to slow down a little bit, got a little bit fluttery and hard to hear. So we had to treat her with emergency medication. But thankfully, very quickly, she came back round and she's here to send home with you now.
My heart just stops to think that it could have gone the other way, basically. It's a terrible thought.
Yeah.
But luckily, she came through and we got our baby back, basically.
Yes. Oh my
So
yes,
it's a relief, a big relief.
Yes.
Daisy will be kept on a course of antibiotics to make sure all infection is completely gone from her body. And then she should make a full recovery.
Oh, bye, baby. All right.
So
See you later, guys.
Thank you so much, doctor. Thank
All
you.
right. Sleep well.
You too. Thank
All
you.
right.
Bye-bye. Bye.
Bye. See ya. Bye.
Hello, sweetheart. How are you? Don't you look better?
A day after surgery to fix Fifi's broken leg, the 1-year-old Spoodle is ready to go home.
That's a good girl. Look at that waggy tail. Hey. Oh, great girl.
Upstairs, Adam and his son Jakob are anxious to see their little girl.
I think everything went well, so let's see how she's feeling.
Hello.
Wow.
Here's your little puppy.
Hello, Fifi.
The surgery went well, and so that's given the whole leg lovely stability. It will be quite a long road, however. She's going to have 6 weeks of incarceration, so she'll be quite bored. I think it's best that she's in a crate or a cage for that period of time. And of course, no more couches. So we need to try and convince her not to get on couches anymore because we don't know what might happen. Hey, you looking forward to taking her home? Yeah. Did you miss her while she was away? Yeah. Although going home with Adam and Jakob, Fifi is definitely going to be catching up on all those cuddles she's missed. She has to do a lot of healing, a lot of very controlled rest before we re-X-ray. But hopefully at that point, I can go back and see her running around the hills of Richmond, and hopefully she'll be A-okay. Bye.
Bye.
You do not like it here. And I hope that your bump is okay, baby. Everything will be fine.
And a week later, Hedgehog Luther's pathology results are back, and Beata and her daughter have come to hear the findings.
2 minutes and then everything will be fine, we know.
Yes.
They're hoping a sample taken from a lump on Luther's face isn't cancerous.
Hi. How are you? Yeah. Oh, hello, miss. Come, let's go through.
Okay, go on.
They've had to be very strong this last year. They've gone through a lot with Luther. She's come through a tumour being removed from her uterus and now a scary little bump that we were all worried about. All right, guys, we got some results back and that little bump that we drained has come back benign, which is good news, okay? It's not cancerous.
Cool.
Okay. So it's basically, they've classified it as a cyst. So it's a structure that forms a little bit of fluid that builds up, and we just need to keep an eye on it, and we need to drain it if needs be. And if it does become a problem, then we can possibly discuss surgery. But if it's not bugging her at all, I see no reason to remove it, okay?
She's just amazing.
We really love her. I think we are lucky that we have her, whatever happened, that we are lucky that she's still there and she is happy and healthy.
She's going to sleep. Yeah. Good night, Luta. She's really gone to sleep.
In Isleworth, Scott is making a very special house call.
Well, hello, sir. How are you? Yeah, good. Hello, Daisy.
Hey, doctor!
It's 6 weeks since Daisy was rushed into the clinic with a life-threatening condition.
Oh, thank you. I know, to see the girl.
Scott removed the little pug's infected uterus after a challenging anaesthetic.
Thank you. So, she put us all through the ringer. How's she been since the surgery?
Much better.
Say hello to the doctor, please.
Oh.
Daisy, oh, come on, don't be rude. Don't do that. You're supposed to say thank you for saving my life. She's run around more than before, so it's
She's
fantastic.
got a new lease on life by the sounds of it.
Yes.
Very good. Can I just have a little look at my handiwork there and just see how things are looking? Can I have a look at your tummy? Hey? Oh, that's healed really nicely, hasn't it? Beautiful.
I just want to say thank you from the bottom of my heart. Doctor, thank you so much. Thank you
So
for
welcome.
everything.
I know how much you guys love your dogs, and obviously this was one of those instances where you put off a decision to spay her because you were worried, and it actually made things a hell of a lot worse.
Yeah.
And now, the other two dogs, are we planning on
Yes.
booking them in?
Yes,
They will.
definitely.
100%. They're both going to get done.
Thank you. I think for your sanity and for mine, let's just get it done.
Yeah,
Yes.
for sure.
Yes.
100%.
They have to be done.
Sound good?
Oh, Daisy. Big cooker. Big
It's
cooker.
a very clear no. No more surgery. Go away.
Yes.
Oh my God, you are a grumpy bugger.
And 2.5 months after emergency surgery to repair Fifi's broken leg, Scott wants to see how the little spoodle has recovered.
Good evening. Hi, how are you? Thank you very much. Hello, Fifi. Hello, gorgeous. How are you? Hey?
Doing really well.
Oh, good. And not minding the vet coming to visit at home.
No,
Hey?
she's so happy.
Very friendly girl. All right, well, let's go in and chat, shall we?
No worries.
Cheers.
Please come in.
So it's an extreme fracture for just falling off a couch.
Scott had to insert a pin and a metal plate to fix the nasty break, and prescribed plenty of rest to give the fracture time to heal.
And so, how's the 10 weeks gone for you?
It's been hard, I'm sure, for Fifi. The beginning part was probably, the hardest because she had the plaster on, so it was difficult for her to even lie down. When we took the plaster off, after 2 weeks, she started putting pressure on her leg, and then she was even happy to run.
Wow.
So she's been really strong and really good.
Well, first thing I noticed when I walked in the doors, you can really not tell which leg it is, which is incredible, isn't it?
Yeah.
With her now fully recovered, is she back to sort of her usual jumpy, happy, bouncy self, playing with the kids?
When we go for walks, when she comes back, she comes and jump on the sofa and just sleep.
Oh dear, you've put Mummy in it there. Jumping on the sofa? No, you can't be doing that. In fact, I've got something to try and stop that from happening.
Aye, aye, aye.
Do not cross, Fifi.
Do you like it?
Do not cross.
She loves it.
Yes. Yeah, I haven't got authority, have I really?
Not anymore. I'm sorry, I can't stop it.
No.
She's just saying thank you for the
Yes.
operation.
Very enthusiastic, thank you. No. Oh. Luckily, I'm better at fixing legs than I am at dog training, hey? Yeah. Yes. I'm
Thank you
glad that
so
she can,
much.
She can use her foot to sort of hook onto me while she's licking me to death. Hey. Yes. Yes. You're a very good girl. Your leg's fixed and your tongue was never broken, was it? Hey?